So I think you have to look at overall health outcomes. You can't look specifically at vaccines when evaluating healthcare policy for kids. You have to look at where are children's actual health metrics? What are our levels of chronic disease? What are our levels of infectious disease? You have to look at all of those different elements. Vaccines are just a small portion of that. And we as a state have actually been moving away from essentially incentivizing specific medical treatments.
I do what I can as a legislator to listen to the science community, research community. One thing that I've learned is just we want to be trying to fix the problem before it metastasizes, before it gets significantly worse. And we've moved away from terminology like herd immunity, moving more towards community immunity, and just listening to the folk who know how to ensure that people are feeling safe with our health laws. It's looking out and seeing if we're dipping below that 95% number. Connecticut has one of the highest vaccination rates in the U.S., but we're trending downward, and that is why we ultimately looked at these laws a few years ago.
So when it comes to the vaccine policies, you have to look at, okay, where are the different diseases that we vaccinate for? Are we actually making a difference with the vaccines? Which is why you need to look at, in addition to your vaccines, you need to look at your dietary policies, your exercise policies, all of those other things to help build that immunity. And we've added a lot of vaccines to our childhood vaccination schedule over the past years, but I'm not sure that that's directly correlated to a decrease in disease or an increase in overall health of our children.
This is weighing the balance between public health and someone's autonomy over their own body. That said, when people felt that this was burdensome government regulation, we were always quick to point out that no one was being forced to vaccinate. This is only if you wanted to use the public school system, because the vast majority of people and parents specifically that are sending their kids to K through 12 recognize the need to have a space free from disease. And so, especially when we're talking about this topic specifically, the idea of freedom, there's the freedom to do with what you want with your body, but there's also the freedom to be in a space that is free and clear from disease.
I think that parental rights, when it comes to making these decisions for their children, is of the utmost importance. And here in Utah, we offer medical, religious, and personal exemptions. And that's because we believe that parents are in the driver's seat. And so, really, even though we say vaccines are mandatory to enter school, they're not, because we allow you to exempt all of them. You have to give that individual choice. I don't think it's right for the government to ever force a medication on someone when there's a risk that it could adversely affect them.
Parents still have a choice with what they want to do with their children, whether it's sending them to a private school or it's sending them to a parochial school or homeschooling. There's still options out there. But when you're talking about a publicly shared and invested in space, I mean, it's public taxpayer dollars that are going towards these education spaces. I mean, like, again, measles, mumps, and rubella, where the impact is that people could lose their eyesight. They could lose various functioning of their body. People that are against vaccinations sort of look at to say that the death rates aren't that high, but there are so many other implications, health implications, that are not just death.
We have a small percentage of medical exemptions every year. It probably sits around 2 to 3 religious exemptions. They used to be quite a bit lower, maybe around that 8%. But during COVID, we actually saw a jump in religious exemptions up to more of like a 12%. And then the rest of our exemptions are all personal, and we don't ask the reasons for those personal exemptions. This is just someone who's decided this is not for me or this is not for my child. And we as a state have to respect their decision.
There are people that have adverse reactions, and I do think that we do need to have carve outs there. but it is a vanishingly small percentage of the people who are in the US that have these adverse reactions. So the best thing that we can do is listen to people in research in vaccinology and epidemiology who can tell us at what point something is safe. There were vaccines out there for HPV that we didn't feel that were ready, and now researchers are saying that it is very much ready for vast public consumption. But we're still publicly, I think that more fearful of what we perceive to be as newer vaccines, even if the research is there.
COVID's obviously the new big one that everybody's talking about. And no, I don't think that it should be added to the list of vaccines. I actually think that as science continues to evolve and as society continues to evolve, we should revisit and look at what we are requiring for schools, because there are probably several things that can be scaled back as we continue to learn more about the different things. And also as we continue to focus more on hygiene. For example, during COVID, there were some pretty awful jokes about the bathroom lines in the men's room getting longer because people started washing their hands. And so you've seen this increase in the focus of society on things like hygiene. Science is never settled. That's the whole nature of science, is that we're always looking at it. And I think that we should apply that to this particular type of science too. What benefit do we think we're actually seeing as a society, and can we back that up?
I do know that in Connecticut that we have not had any serious conversations, nor are the advocates and folks such as myself interested in pushing the COVID vaccine as being one of those vaccines that we would lump in with something like MMR. I think a lot of what we see as vaccine safety and vaccine regulation is this need to protect people that are immunocompromised. So if you literally cannot get a vaccine, we want to make sure that as legislators that we are protecting those folk, and you only do that when you have community immunity. I believe strongly that researchers and folk in the medical industry need to do as much as they can to communicate with their legislators.
Utah has several different things that we can use when it comes to dealing with outbreaks, specifically in schools. So, first, our health departments have the ability to issue orders to force people into quarantine. They've never used it for measles. It's only been used for the first COVID patient we had here in the state and tuberculosis. Those are the only things we've ever had to issue a health department order for. When they believe there's an exposure to measles, your quarantine is 2 to 3 weeks. But if you test positive for measles, your quarantine is actually only 1 week. And so it was really interesting, just based on the life cycle of the virus, to say, okay, it's actually from a get back to real life perspective, better to just go get it and be done with it. But obviously, we're not wishing measles on people. The government closest to the people can work best with the people. And so rather than being state heavy on that, I really like that we can let those local health departments work with the individual schools to set up those alternative education arrangements, which can then create that separation that we need to slow the spread of disease.
There is the sense of, instead of resolve the problem, just say that the problem isn't as bad as it actually is. And especially with something like measles that can get out of control so quickly, I just don't believe that's good enough. But that said, because this is predominantly done on a state by state basis, an outbreak in Texas is going to affect Connecticut. It's going to affect all states. It's a frustration of mine that there is a patchwork on vaccination regulation in the US, because if there's an outbreak somewhere, that will lead to an outbreak everywhere.